Thank you for joining our July 23rd Women's Health Tech Wednesday. I am very excited to be the host today and joined by Naomy Diake, who is a project coordinator for the National Kidney Foundation of Michigan, as well as a Delphi scholar. We're excited to have her join us today. And before we jump into the conversation, I just wanted to highlight our upcoming symposia that's happening next week, next Thursday, July 31st. You can see on the screen, we've got a number of esteemed panelists who will be joining the conversation, and it'll certainly be a very interesting and engaging conversation. So hope that you all can make time to join us. So for today's session, again, I would like to welcome Naomy Diake, and she has great experience in the healthcare space, working at the National Kidney Foundation of Michigan, as well as being one of our Delphi scholars here with HITLAB. So Naomy, thank you so much for joining us. And I'd love to turn it over to you before we jump into some of the questions that we have for the session, for you to share a little bit of your background and your bio so everyone can get to know you a little bit better.
Yeah. Hi, everyone. I'm Naomi. I'm a University of Michigan Ann Arbor graduate where I earned my Bachelor of Science in Biology, Health, and Society and a minor in oceanography because once upon a time I used to want to be a marine biologist, which is actually pretty different from where I am now. But over time, I found my passion leaning more toward public health, and so I made the pivot. I now focus on community health, technology, and disease prevention. I do currently work as a program coordinator for two programs at the National Kidney Foundation of Michigan, which is a local nonprofit right here in Michigan. And I'm also studying full time at NYU's School of Global Public Health, earning my MPH in Community Health Science and Practice. I just feel so grateful to be joining the cohort of women that are, that have come on this webinar before me. And I'm really excited to be having this discussion with you today, Amy.
Well, we're very lucky to have you and really excited to have you share your experience with our audience, as well as other, sharing your internship story, as well as the work you're doing in the healthcare space, and also in public policy. So thank you so much for joining us. We're very fortunate to have you today. So, we do sponsor the Delphi program here at HITLAB. It's our internship program, and fortunately are working with you in this cohort. Can you share a little bit about the work that you are doing in your internship program, because there are many, and what are you learning, and how are you, sort of, what is the shared value? What do you feel that you're bringing to the internship, and what are you learning?
Yeah, no. I've actually been an intern with HitLab across three different terms, and this is actually currently my fourth. I joined the team in January of 2023 and really stayed on until December of 2023, so for a full year as a member of the Women's Health Tech Initiative and the events and marketing teams. I then graduated from the University of Michigan that same December and came on as the events coordinator shortly before working as the program coordinator for the National Kidney Foundation of Michigan last May and attending grad school full time last August. Initially, I would say I supported the Women's Health Tech Initiative and events and marketing team by leading the development for a digital health peer mentoring program, aiding in the production of webinars like this one, staying in regular communication with industry leaders as our guest speakers, sharing insights with leadership, and really assisting in marketing campaigns. I now support health tech innovation in a way that combines education, business development, and AI research to close gaps in public health and advance health literacy, and really just improve the care for diverse communities. So I'm doing a little bit of like everything.
Well, and the work you've done with the programming and the communications and the marketing aspects are so important, because again, in women's health tech, it is a very sort of underappreciated and underserved area, as well as other areas that have, that are not necessarily top of mind. So really appreciate the work that you're doing to shine a light. From a women's health tech perspective, what's kind of sparked your passion in this arena?
Yeah. Honestly, there wasn't one defining moment during my time at HITLAB that sparked my passion for women's health tech. I think it developed naturally over time. I really enjoyed the work that I was doing as an intern. And since I was about to graduate college, I had the chance to think seriously about the kind of roles and opportunities I wanted to pursue. I knew I wanted to align with work that really spoke to my passions. And my supervisor at the time, who is actually still my supervisor right now, Ainsley, played a big role in that. Her background and her mentorship really helped me see all of the different directions I could go within women's health. And truthfully, that interest really started way back in high school. No matter what I explore, I think I always circle back to women's health in some way. And being surrounded by professionals doing impactful work during the internship really fueled that passion. And even now, while my focus is on community health and prevention, I do stay connected to women's health through my ongoing research and interests.
Well, that's great because it's much needed. And again, at HitLab, we have the Women's Health Tech Initiative. I actually chair that organization, and we are always looking for people like you with that passion and commitment and willingness to really roll up your sleeves and drive the change that we need to accelerate innovation in women's health. Because we're not just little men, we are our own entities and different genetic makeup, and we need to be considered differently than the general sort of way that healthcare has been
Right.
researched and analyzed over the years. So really appreciate the work that you're doing in that space. Can you talk a little bit about the work that you're doing in your graduate program through NYU's School of Global Public Health? Um, how has that shaped your understanding of this community-driven and tech-based health solutioning, and I'm sure it also ties into women's health tech as well, but share a little bit about how that's shaping the direction that you see yourself going in.
Yeah. NYU's program has been fantastic at helping me connect theory with real world practice. Luckily, I'm already working in community health, which is the very focus of my studies, which makes it so much easier to apply what I'm learning directly to the communities I do serve as a program coordinator. My courses and professors are really pushing this systems level thinking and innovation. And lately, I've really been diving more deep into different health interventions as well as program leadership and management strategies that are guiding my daily decisions here at work. Overall, my experience has highlighted the importance of balancing community voices with the integration of new tech-based tools in public health solutions that we're constantly seeing.
That's great. And I'm curious to get your thoughts too, as you think about, your day job as, the program coordinator for the diabetes prevention program at the National Kidney Foundation in Michigan. Diabetes is definitely an epidemic across all of our communities, whether you're rural, urban, wherever. It is a disease that affects many people individually as well as loved ones, from a caregiver standpoint. Can you talk a little bit about, the work that you're doing at the Kidney Foundation and how, the what your learnings in your graduate school program, what is that? How's that kind of informing the work that you're doing today and maybe into the future in this space?
Yes, absolutely. My days and weeks as a program coordinator are always changing, which I really, really enjoy. That's really why I'm attracted to this type of work. I get to coordinate two separate programs at the National Kidney Foundation of Michigan. So the first one is the diabetes prevention program, and then the second one is a matter of balance, both serving diverse communities. To give some context, the diabetes prevention program is a year-long lifestyle change program designed to help people with prediabetes live longer, healthier, and happier lives by preventing type 2 diabetes. And on the other hand, A Matter of Balance is an 8-week long program for older adults that focuses on reducing their risk and fear of falling by encouraging physical activity and cognitive strategies. For both, I work closely with trained lifestyle coaches and participants to really make sure that workshops are running smoothly and that everyone gets the support that they need. I do handle the logistics, and this can be things like coverage options, materials delivery, sharing of resources, and really just answering any questions or concerns about how the workshop will go. Since I am a trained lifestyle coach myself, I also get to work directly with participants, and I'm currently coaching my own diabetes prevention program workshop right now. A few months ago, I actually coached and completed a Matter of Balance workshop too, and it went really, really well. But I think beyond coordination, I also lead info sessions throughout the year, and I actually have one scheduled for later on this evening. But I also engage with potential participants at local health fairs and community events. So really, I'm not just managing logistics, I'm actively supporting health behavior change.
Absolutely. And disease states like diabetes are so heavily behaviorally and motivationally influenced. It's really important
Yeah,
to address those areas. And I really appreciate the work that you're doing with actually the one-on-one, the individuals. As we think about the potential and the opportunities that we have with digital health to support newer, better interventions in some of these disease areas, at the end of the day, we can't forget we're talking about human beings
exactly.
and working with them in a real life type of way. And so that's critically important. So thank you for, playing that role and supporting it. But when we think about the opportunity and the potential improvements and optimizations that we might have with technology and digital and data in these chronic disease spaces like a diabetes, from your perspective, what types of digital or technological innovation areas are you seeing really kind of move the needle around greater adherence to medications, supporting behavior change, supporting communication and understanding? Just curious to get your perspective on that.
Yeah, I feel like we have a lot of like cost-free programs that really like push back on the boundaries of like language, social determinants, and things like that. So we offer a lot of our cost-free programs in different languages. So cost, language, and culture aren't barriers that keep people from getting the support that they need. Ultimately, preventing diabetes and really any other chronic condition is way more cost-effective and empowering than just treating it after the fact. And so that's why we're doing what we're doing. But we also like to look at the barriers that can include lack of awareness, health education, limited access to healthcare, transportation challenges, few opportunities for physical activity, food insecurity, even stigma. And that's where those community and tech-based enabled solutions come in. We use tools like mobile health apps, remote lifestyle coaching, and virtual workshops to really reach people where they're at. And at the core of everything, we focus on building trust, tailoring our programs culturally, and providing this consistent support to really make that difference.
That's great and really impressive. And I think it touches on an area that I think is really important for the audience to think about and hear, as it relates to some of these like apps or mobile interventions or virtual supports. As you're designing these solutions, if you're a startup or if you're working with these types of interventions, the importance of making sure that you're taking a human-centric design approach, because the people that are going to be using them, many times it's the actual patient or maybe a caregiver of the patient, or the treatment team, making sure that the design is something that is convenient, easy to access, simple to use for the person who actually has to use it. Can you
Exactly.
talk maybe a little bit about, opportunities for co-creation with the actual end users based on the work that you're doing in this space, the opportunities that the startups have in working with organizations like a kidney foundation to start to, support that user-centric design?
Yeah. I think first and foremost, it's really important for public health leaders to address online abuse, digital health, digital harm, diabetes prevention, all these types of issues because they have real long-lasting impacts on our physical safety, on our mental health, and just really access to care in general. Digital spaces are now essential to how we're connecting, how we're working, and how we're accessing health information, as we're seeing now all the time. So when they become unsafe or, they create barriers to well-being, they can deepen existing health inequities. And so I think public health must really evolve to protect people, not just in clinics and in person, but really in these digital ecosystems that we're in. This again is a bigger health equity issue and not just a tech problem. And I don't think it should be isolated to just the tech industry, like alone.
Yeah, it's interesting to think about. That's sort of a different area that hasn't necessarily been incorporated into, some of the thought processes around some of these interventions. I know that in your extensive experience, you've actually done some work when you were a researcher in London that was specific to this notion of tech-enabled violence and the implications for women and young girls. Can you share a little bit of your sort of your experience, your insights, and what you uncovered during that time in your research?
Yeah. So, I mean, just to switch gears a little bit from like disease prevention to really women's health and mental health, in my research on tech-enabled violence during my time in London when I studied abroad there, I uncovered how digital platforms, particularly social media and emerging technologies like AI, are increasingly being used to facilitate gender-based violence, especially against women and marginalized groups like children. This abuse can really range from cyber harassment and like stalking to image-based sexual abuse and disinformation. And this can often spill into real world harm. To get into more of the specifics of like my research specifically, I found that while cities like New York and Paris have really taken steps to address the issue through multi-sectoral collaboration, legal reforms, and even education, places like London and the broader UK still face major gaps in data collection and prevention strategies, and really just victim support. Ultimately, the research really highlighted the urgent need for intersectional human rights-based approaches that center on the voices of women and children and really hold these digital platforms accountable. Tech-enabled violence is not just a digital issue. And I know I'm going to say that a lot today, but it's deeply rooted in these broader structural inequalities and are amplified by the design flaws of technology itself. I think many platforms are built without considering the safety or lived experiences of, women or especially those from marginalized communities or its users, which can then allow for existing power imbalances to be replicated and then intensified online. And by addressing this crisis, this would require not only stronger laws, policies, regulations, but also that fundamental shift in how we're designing, how we're governing, and how we're using said technology.
Yeah, I mean, that you just packed a lot into what you just shared, and it's something that, I think doesn't it goes kind of under the radar a bit, so I think it's really important to raise that up, especially at a platform like this, but then again, really trying to encourage, you know, I mean, so something is, like AI, the AI space. We know that most of the programmers and the trainers of AI are male. We need more females in the space to have that balance and have an unbiased opportunity in this space, which because the AI, as you shared, can lead into a lot of other areas of disinformation or potential tech-enabled
Mhm.
violence that is very detrimental to the overall community, whether it's male or female. So I think it's an important thing to keep in mind as we advance in this space and continue to try to create a more unbiased and equitable space for the broader community. So it's very interesting there. I kind of taking a step up and back. what can public health leaders do to address what you've just talked about, this online abuse and digital harm? And I know maybe a step removed from digital health, but again, when you think about the mental aspects of it, just curious to, if you have any thoughts on what the public should be doing to manage this or intervene in this space.
Yeah. I mean, just like how I mentioned earlier, like public health needs to really evolve to protect people, not just in person, but really in like these digital ecosystems because they're part of how we're connecting with people, how we're talking. We rely so much on technology nowadays. And so when they're becoming unsafe, like that's creating a bigger issue than in and of itself. But I just don't think that it should be isolated to the tech industry alone. And so we must like kind of take a step back and look at multi-sectoral collaborations, laws, accessibility, things like that, that really help us paint that broader picture. And I also just think that in order to ensure digital tools are truly serving their communities and their users, it's really essential to involve said communities from day one, not just as an afterthought, but as really equal partners in the design, the implementation, and the decision-making process. This means listening deeply to their needs, to their experiences, and really concerns throughout every stage. I think ongoing evaluation, things like feedback loops and surveys must really be built into the process and implemented so that tools can be continuously improved based on these real user inputs. And most importantly, they need to be built with people, not just through them or for them, but centering on their voices, cultures, and lived experiences, lived realities to really create digital health solutions that are relevant, accessible, and really effective for the most part.
I think that's really well said. It's really that holistic approach, and again, making sure that as you're looking to solve a problem, you're including the people who are living it as a part of the solution and getting that human perspective. I think that's great. So shifting gears a little bit, from an advisement standpoint, you've got tremendous, very impressive experience, educational background, and you've spent a lot of time in the research space. What advice would you give to others or students or anybody in their early career who want to work at this intersection of technology, public health, community-based programs? What can you share with the audience here?
Yeah, I would definitely say first and foremost to stay curious and open. My curiosity is definitely one of my strong suits, and it's one of my strengths that I really think keep me going. We're always seeing new studies, new research, new data being pulled and implemented. So this field is constantly evolving. So I would say just don't be afraid to ask all the questions. I know they can come off as annoying sometimes, but I love asking questions. I love receiving them because I see them as opportunities to learn. In fact, when I first started my job, which was my first professional experience, by the way, I often felt vulnerable by being the youngest on my team, which I still am to this day, and having the least amount of experience, which I no longer am. But it was intimidating, and by confiding, I think, in my support systems, that helped me realize that even though I wasn't an expert, my perspective was still very valuable, still very fresh. And that encouragement gave me that confidence to, contribute meaningfully to keep on learning. I would just say, yeah, don't be an expert or don't wait to be an expert to get involved. Your voice matters right now. And I think me participating in this webinar as a guest speaker today alone is an example of stepping into opportunities that are making your perspective heard. I would also lastly add for people specifically trying to get into that intersection to really prioritize community needs and passion over tech trends. You talked about it, Amy, earlier on. Like we're really focused on these people-centered, participant, patient-centered solutions. And so by always remembering that staying grounded in the people you're serving, this will guide your work. It'll guide you towards these more real and equitable impacts over these temporary or like bandage-like solutions.
Yeah, no, I love that. I always think about it as, the science and the technology are really important, but if you don't factor in the human experience, it may not ever get accessed or used or and deliver on what you're looking for. So we can't get so caught up in the shiny object idea of like really cool technology or a really new way, different way to do something. If it doesn't work for the person, the end user, the person who's going to need to benefit from it, you're kind of going at it the wrong way. So just making sure that at the end of the day, no matter how many advancements we have in innovation and technology and digital, or even science, that it's we're about the human beings at the end of the day. So it's got to come full circle there, and it really needs to start there from the beginning. But and I love your story that that's where you are. I mean, you are working with people on a daily basis who are dealing and managing a very, very serious disease state. And so you're getting to see the reality of what it's like to live with a disease like diabetes every single day. And how better you can support them with the promise of things like innovation and technology and data and digital. So it's really, really you're positioned in a great spot, and really excited to see how you take your background and your experience and your interest and passion to the next level to really move the needle in healthcare, not just for women and underserved communities, but for the global community overall. Because at the end of the day, everybody benefits when we have a healthier community.
Mhm.
Um, Before we sign off, are there any final thoughts you want to share, or anything? I just wanted to give you the opportunity to say a few last words.
Yeah, I definitely want to bring attention to why diabetes prevention is especially critical in underserved communities. Diabetes prevention is super critical in those specific communities because of social determinants like food access. I mentioned it earlier, income level, insurance status, and discrimination. They all increase the risk of getting type 2 diabetes. And I also want to bring attention to the fact that right now in the US, over 96 million adults, that's more than 1 in 3, are living with prediabetes. And the scary part is that more than 8 in 10 of those people don't even know they have it. In many minority communities, higher rates of obesity and less healthy dietary patterns really raise the risk of developing type 2 diabetes. And that's why it's so important for us to be offering specialized sub programs like the ones we do here that target specific underserved groups across Michigan, really across the nation. And this culturally relevant education and peer supports, they're making a big difference in engagement and success. Again, we offer our programs in cost, like they're cost free and across different languages. So those aren't the type of barriers that we're really battling. And there are just so many success stories that I could also share, but I'm just really excited about this work. And I think that when you put people in positions of power that are really passionate about the people, like you get so much success and engagement and progress from it. So I'm just really excited about this kind of stuff.
Well, thank you so much, Naomi. It's really impressive and inspirational, and appreciate you sharing your story. Congrats on all the work you're doing, your success, and keep up the good work. And we look forward to watching your career continue and having you back one of these days to talk some more.
Yeah, no, thank you so much. I appreciate it. Thank you, Amy.
Take care.
You too.